Schizophrenia is a widely known mental illness in which people suffer from hallucinations, delusions, reduced speech, lack of attention, disorganized speech, and flat affect. Flat affect is when you're in a state that does not express emotion. While schizophrenia may be a widely known mental illness in today's time, schizophrenia was not taken seriously until the 1800s by a doctor named Emil Kraepelin. Even then, schizophrenia was still not fully accepted, but is seen as a dementia precox. The term dementia precox is when the individual undergoes a psychosis, essentially in the period of puberty and adolescence. While schizophrenia has an ancient history, Emil Kraepelin was not the first person to discover it. Rather, he was the person to acknowledge it as an illness.
Schizophrenia goes back as far as the ancient Egyptian era, in which the people at that time thought of mental illnesses as a curse placed on them by the gods. Then, as time passed on, around 460 to 377 BC, mental illnesses really took a shine, in which it was a giant scientific speculation. They thought the reason for schizophrenia could be a sign of a huge depression. The depression could in fact be so critical that the individual would not be able to accomplish their everyday tasks. They would be so out of commission that they would not be able to contribute to society. After the Civil War, schizophrenic cases started to rapidly increase. Many people suffer from a condition in which an individual suffers from past trauma. Emil Kraepelin discovered mental illnesses where he broke down cases from the war. Emil Kraepelin research consisted of patients who had manic depression and dementia praecox, later defined as schizophrenia. Emil Kraepelin studied subjects and recorded their behavior, in which individuals show signs of mood swings and manic depression, along with an episodic. Schizophrenia is an illness that offsprings from other illnesses, making it a combination of frequent symptoms. These symptoms could often all react at the same time, causing the individuals to feel multiple symptoms at once. This could be a combination of manic depression along frequent memory loss. This is why schizophrenia is one of the worst possible mental illnesses an individual could face. People with schizophrenia back around the late 1800s were seen as impulsive and not seen as functional. They were seen as a danger to the community for the reason they will not cooperate with people in a manneristic way. They were also seen sometimes even killed because of the chaotic behavior they projected. In the 1900s, people with schizophrenia were often treated with insulin coma, metazoll shock, electroconvulsive therapy, and frontal leucotomy. Literally, more than half of these methods were discontinued because of the amount of failed attempts, and it typically got worse than better. The only treatment that has stuck around to the present would have to be insulin, in which is a peptide hormone produced by beta cells of pancreatic islets. It helps the patient feel at ease, since their anxiety is always at an all time high and they have to bear with it. People with schizophrenia have an all time high with anxiety, meaning if we would ever encounter a person diagnosed with schizophrenia, they would be walking around giving off an discomfort. They would look like a person trying to figure out where they are and how they could get away from everyone else. It has been recorded that people with schizophrenia would typically try to look for a way out, usually ending up harming themselves or those around them. There are many stories behind schizophrenia and attacks, along with ups and downs, to people that have this illness. People can look at them and admire them for living with such a difficult illness, or people can react in a way that is disgusted and usually judgmental. Parents that deal with their offspring developing schizophrenia is a hard time, but usually it gets easier to live with. However, parents might view schizophrenia as another reason to send their kids far away from home in the worry to endanger the little ones in the household. The parents won't feel assured with their mentally ill child to be left alone with their defenseless baby. The view on schizophrenia has definitely changed over the course of time. People have learned to adapt to the illness and are more aware of the illness than sooner years and where you'll be killed if people discovered you had it. More caution has been created for those who have schizophrenia and determine how severe schizophrenia truly is. Treatments on schizophrenia have also improved as insulin, in which its early stages it was not as effective. However, as time passed on, scientists have created new ways and found better ways to modify the drug and eventually improve it, making it overall more effective than it previous was. Then we have metrazole shock that involves electricity to the brain. This treatment, however, was discontinued as soon as the 1940s because of how deadly the cases were getting. Then we have electroconvulsive therapy. In other words, this is a form of electricity to the brain that is passed through the brain and triggers brief seizures. This treatment was a dangerous process and usually caused patients to have huge muscle aches and other side effects that were irreversible. A phenomenal story that can show us the severity of schizophrenia will be a story told by Tanara. Schizophrenia could work in a surprisingly weird way. For instance, you could be totally normal and have a positive mindset, and yet come down with schizophrenia. The story of Tanara can educate us further on how schizophrenia truly works. Tanara was a 27-year-old woman when she discovered that she had schizophrenia. Tanara at first was a bubbly, happy person who loved R&B music and overall was a pretty normal person. She was the all-time best server in her restaurant. Tanara was also attending college and juggling between that and her job. But by the end of 28, Tanara began feeling paranoia and started hearing weird voices in her head, and a sense of not doing anything. By the end of 29, she went to a doctor's appointment in which they gave her medication for bipolarness. However, Tanara stopped taking the medication as soon as she got out of the hospital. Soon enough, Tanara stopped experiencing the symptoms, and she for sure thought that she was cured. However, towards the end of 2010, Tanara reached a turning point in her life. Tamara's grandmother was awfully sick during Christmas time, and Tanara snapped seeing her grandmother being hooked up to all the tubes and had to be escorted out of the hospital. Later on, Tanara got into an altercation with her neighbor about a parking spot. Tanara got sent to jail, and the judge said that she must be sent to a psychiatric hospital. There, Tanara was diagnosed with schizophrenia, and throughout the whole ordeal, Tanara was relieved because she finally got the help that she needed. She felt that she could open up again to society. Slowly, Tanara started attending movies and parties with other people like her. In the end, Tanara felt like she opened up more to society and to herself by knowing the fact that she could live a normal life again. Overall, this story showed the purpose of how an individual fights society and how an individual seeks for help in our society.